Okay, I think we're live now. Hi, everybody. My name's Justin Williams. I'm a child and adolescent psychiatrist in Aberdeen. It's my pleasure to introduce this. I think we're live now. Before lunch. My name's Justin Williams. I am a child and adolescent psychiatrist. I'm listening to myself.
Like we're live, so I guess I'll just start.
Sorry, I think I'm just going to go straight on and introduce you, Daniel. Daniel Smith is Professor of Psychiatry at the University of Glasgow and Honorary Consultant Psychiatrist at NHS Greater Glasgow and Clyde. His primary clinical interest is in bipolar disorder. He's currently leading programs of research in a range of areas, including genetic epidemiology, health informatics, mental health data science, and adolescent mental health. He's co-PI for the Schools Health and Wellbeing Improvement Research Network, and he also leads the Sleep Circadian Rhythms and Mental Health in Schools Research Network, and he's going to talk about schools-based mental health research in Scotland. Sorry about that.
No worries. Thank you very much, Justin, and thanks for the invitation to talk about our work this afternoon. The title of my talk is School-Based Mental Health Research in Scotland. And I want to kick off with a key question, really, which is why should we and why do we do mental health research in schools? What's the benefit? What's the added value to what we normally do? So there's lots of reasons for this. You won't be surprised to hear. The first, I guess, is that children spend an awful lot of time in school, as many of you know, at least 1,000 hours per year. There's always been a big focus on families and family environment, which is correct, obviously, but I think we're missing out on a lot of time that kids are engaged elsewhere, particularly in school, so that's important. There's also a lot of kids in school in Scotland, about 700,000. I don't want to say they're a captive audience, but they sort of are, at least in school hours. And obviously with COVID and other things happening recently and problems, you know, with child and adolescent health services, schools increasingly are very focused on mental health and well-being and are really trying their best to address that as best they can. I hope what I'm going to demonstrate today is that you can do research that is really beneficial to schools, and I think Shine is a really good example of that. So schools can be engaged in research, but get a lot out of it as well. From my perspective as a researcher, there's the potential really to do large-scale population-level research on young people. And I'm going to give you an example of that with some teen COVID life data that I'm going to show you. And discovery science at scale. And I think SCRAMS, or Sleep and Circadian Rhythms Network, is a good example of how you can engage with schools to do discovery science. Obviously, schools could be a locus for developing, co-developing interventions and evaluating interventions, both targeted and universal, and there's a lot of interest in that currently. And then in Scotland, of course, we've got this extra bonus, really, which is that there's the potential to link data that you collect from schools with other routinely collected data sets in health, for families, for education, attainment, etc., etc. So there's real potential to do some really exciting data science work in schools. And ultimately, of course, we want to inform health and education policy as well. And then another excellent reason, of course, is that it's great fun working with teachers and working with pupils, as I've found over the last 12 to 18 months. So what is SHINE? SHINE is the Schools Health and Wellbeing Improvement Research Network. This has come out of an MRC Pathfinder Award that we got a couple of years ago, and it's been up and running now for a good 18 months or more. And as you'll see, the focus is really on doing research in schools on wellbeing, but also helping schools in terms of their wellbeing curriculum. It's a big effort with lots of key people involved, including the Scottish Government, Education Scotland, the Triumph Network that some of you may know of. We link closely with a network in Wales, the School Health Research Network, and it's a collaboration between different universities in Scotland as well. So I'm pleased to say that SHINE is now a truly national network of schools ready for research in mental health. There's 243 SHINE schools signed up. That number is increasing every week. We currently, in theory, have access to over 124,000 pupils, and all the local authority areas are covered. And we've got a really nice geographical spread from the far north, Shetland, Orkney, right down to the borders, from east to west, and from urban to rural as well. And also a nice mix of primary and secondary schools, including some special schools as well. So SHINE really came out of us building on work in Cardiff that established a national Wales Schools Health Research Network that I think covers every single school in Wales now. That was led by Simon Murphy and Lawrence Moore when he worked in Cardiff. And an additional advantage that we've had is that Joe Inchley, who works in Glasgow now and runs the international WHO Health Behaviour in School-Aged Children surveys. She's the international coordinator and also the coordinator for Scotland. So we were able to combine these two aspects to bring about SHINE, really, and I'll give you a little bit of detail about that. So the HBSC really stands for this Health Behaviour in School-Aged Children. It's an international survey that happens every couple of years. And as you can see, it addresses health behaviours, health and wellbeing outcomes, and some societal context as well. And just going down that list that you can see, hopefully, you'll be aware that there's quite a lot of mental health in there, quite a lot of behaviour, screen time stuff, sleep, stress, body image, relationships, socioeconomic status, etc. So the HBSC is a really excellent platform that we've been able to build on in creating surveys within the SHINE schools in Scotland. I should say that quite a lot of the SHINE schools are already HBSC schools, but not all of them are. So we kicked off SHINE with a conference back in May 2019, which is a really great success in terms of bringing together government, Health Scotland, Education Scotland, all the local authorities, and really getting some high-level buy-in to support the work of SHINE. At that point, we were able to share some of the research briefings that we're sharing with schools. I'll give you some examples of that. And then more recently, albeit virtually, we delivered the second SHINE conference. We were able to give talks on anxiety, on sleep, on how to use your health and wellbeing data if you're a teacher. And then we heard from the SHINE schools about how they're applying the data that we feed back to them within their school setting. So a really interesting virtual conference, which I think you'd be able to access some of the content of if you go on the SHINE website. This is an example of some of the HBSC data that we can feed back at a school level to schools that are part of that. So we can give them reports on bullying victimization, for example, reports on perceived body size of Scottish children, school children and linked with mental health. And another example is educational aspirations and adolescent health behaviour. Schools have found these really helpful in terms of informing their PSC curriculum, for example. We've put a lot of effort into making sure that the reports that we provide are useful and understandable and accessible. So quite a lot of thought goes into how to present the data that we feed back so that schools can really make best use of it. And by that I mean sharing with pupils, sharing with parents, and sharing with the wider school community as well. So that's led to some really excellent engagement activities. I think this is Dunblane High School. I've got the crest, but not the school name. I think it's Dunblane. Someone will correct me if I'm wrong. But so they created wellbeing days where they look at the SHINE data in detail and they make plans to for how to address issues that may be more pertinent for their school. We've been involved in learning expos, etc. And I guess the key thing is to really empower pupils to understand the evidence and to start to make changes based on data. So that's a key point about Shine. So that's more general information about Shine, but obviously we're interested in doing more detailed data collection in Scottish school children. And one of the priorities that has been identified throughout the conferences and through talking to teachers is this issue of sleep and the link between sleep and mental health. So one of the first things we did, which is hopefully going to be published quite soon, is we tried out whether it's possible to get good objective readings of rest and activity from teenagers in Scottish schools over a 2-week period, and also to collect some mental health data. And I'll just give you a quick summary of this feasibility study. So we had 4 schools involved, 2 primary, 2 secondary, 69 pupils volunteered. Almost all of them returned their wrist-worn Actigraph or their Fitbit for us to look at in terms of the data, as well as the questionnaire data. Not everyone was comfortable wearing it, but most of them wore it for the 2-week period. And I guess a headline message from that feasibility study was that, you know, I guess it's not that surprising to many people who've got teenagers at home, that teenagers don't sleep much. They sleep on average 7.5 hours per night. They also go to bed late, which is no big surprise, but especially at the weekends. 11:30 at weekends on average is when they had sleep onset. And then a key point is that objectively looking at how they catch up on sleep at weekends, this means that almost all the pupils that were surveyed had something called social jet lag, so they needed to catch up on sleep. And what that really means is that almost all teenagers have sleep deprivation at one level or another. So that's quite important, and hopefully I'll show you in a moment why it's important for mental health. So we're very excited at the moment that currently we are engaged with all 243 Shine schools to complete quite a comprehensive online pupil mental health survey. That's currently ongoing, and already schools are getting the data back, and it's already started using the data from that. But we'll be running this survey whenever it suits the schools individually up until December of this year, I think, maybe a bit further beyond that. And essentially, these questions that we've developed were in response to what teachers and pupils and parents were telling us we should ask about. We aim to provide instructions, obviously, to how to administer it. And then whenever the data has been collected, schools will receive pretty comprehensive feedback on school level data, as well as things like challenge questions to guide discussion and interpretation of the data within the schools. And obviously, we also give them lists of helpful organisations they may want to consult with if there are specific issues identified in their school. Just for those who are interested, this is the measures that we've used in the current mental health survey within schools. You'll see these are fairly standard measures like the WHO Wellbeing 5 Index, the Strengths and Difficulties Questionnaire, some positive mental health questionnaires, the Social Emotional Survey, and then slightly different questionnaires for primary schools, which are more about feelings and well-being and subjective happiness and that kind of thing. So a combination of different surveys based on primary versus secondary, but quite a lot of data, and we hope to obviously get a high response rate for this. So that was Shine. I want to move on slightly to talk about Generation Scotland, and particularly something called Teen COVID Life. And the reason I wanted to mention that is that this happened during lockdown, and it's some really interesting data. And Shine is really important in terms of increasing the response rate to the Teen COVID Life survey. So let me tell you a little bit about that. This is run obviously by the Generation Scotland team based in Edinburgh, led by David Porteous and colleagues. And I want to acknowledge people like Archie Campbell, Robin Flay, Cliff Nagle, Chloe Fons-Ritchie, etc., in terms of providing the data to us and letting me today show you some of this early data from Teen COVID Life. So what happened was that there was a survey which was encouraged by Shine schools between 22nd of May and 5th of July of this year. And so that was right at the end of the point when kids should have been at school but were not at school, and leading into the school holidays. So pretty stressful time, I think, for everyone at that point. Overall, well over 5,000 surveys were completed, mostly a 2-to-1 ratio of female versus male respondees, and covering 283 schools across the whole of Scotland, really. So I'm going to give just a sneak peek of some preliminary data from that. And obviously, we're interested in sleep and mental health, so I'll show you the specific questions in those areas. So we had full data on 4,482. As I said, females to males ratio 2-to-1. We looked at the WHO-5 Wellbeing Index and the Short Adolescent Sleep-Wake Scale, which is a questionnaire covering quality of sleep in the preceding weeks. Unsurprisingly, there was a relationship between higher scores on both of these measures, so that relationship is stronger for girls than for boys, and that may be relevant, as I'll show you in a second. And this is some general data about this survey. So this is the WHO Wellbeing Scores. You'll see on the left here the total score, and I think what's important is that the mean score is less than 50, and actually less than 50 is above the screening, is the screening threshold for a risk of poor mental health. So that was the average score, if I go back. And then also of interest is the fact that girls were doing less well than boys on this global measure of well-being. So, as I just mentioned, what you can do with the WHO-5 scores is you can divide it into those who screen positive for low mood and those who screen positive for risk of depression based on the score thresholds that they have. So those scoring 50 or less are screening positive for low mood, and as you can see, that's a fair proportion of the whole sample, and it's more likely in girls than in boys. And then screening positive for depression, this is an additional 30% of the sample are screening positive for risk of depression, and again, girls doing significantly worse on that measure than boys. So I think that's a key finding, that maybe girls, I mean, there could be lots of reasons for why the reporting is like this, but it is also obviously possible that girls were coping less well with the lockdown situation than boys were. What about sleep quality? Again, this is the mean scores from the 10-item sleep quality questionnaire. The score for whole samples on the left. And again, pretty striking is the fact that on average, girls did less well in terms of sleep quality than boys. It's possible to divide that scale up into 3 subscales, including going to bed, maintaining sleep, and waking up from sleep. And again, what this shows is that boys tended to maintain their sleep a bit better in terms of the quality of the sleep, and they were feeling better when they woke up in the morning. So just to emphasize that there are different aspects of sleep where there were gender differences in evidence. And then finally, with this data, just to show you the correlation really between those who screen positive for low mood and screen positive for risk of depression against their mean sleep score. Again, this is just really demonstrate that across those categories, sleep is a factor. I think there's a correlation between better sleep and greater likelihood of not screening positive for either low mood or risk of depression. So that was the Teen COVID Live data, but just a preliminary look at that really, and there'll be much more on Teen COVID Live coming out in the next few months. But I think it's fair to say that mood and sleep were major issues for many adolescents during COVID restrictions. Obviously, these two things are related, but this is highly complex and there are many other factors involved. I'm sure I'll get some questions on that, hopefully. And I think it's reasonable to say that girls seem to have more issues with mood and sleep than boys. And it'd be interesting to think about why that is the case. So I'm going to move on. Returning to Shine a little bit to say that I've only really given you the tip of the iceberg of the Shine activity. And we've got big plans for Shine over the next few years. There's potential to obtain consent and to link Shine schools and Shine pupils with the excellent share register that is in evidence in Scotland, so we can really start to think about linking data, especially with health records, for example, and also inviting pupils to take part in other studies for which they would be eligible to take part in. So that's a piece of work that we have started and it will be ongoing. And equally, there are plans afoot for a Scottish school census of health and wellbeing, and we've been working with the Scottish Government a little bit to inform that, and we look forward to helping look at that data when it eventually is collected. So to summarise Shine, I think it's fair to say that we're excited about it. There's lots of possibilities, and we're very open for people to get in touch with us. If you think you can contribute or help with Shine, or you want to be involved with Shine, then please don't hesitate to get in touch. So I'm going to change tack slightly and talk to you about another network of research in schools called the SCRAMS network. This stands for Sleep, Circadian Rhythms and Mental Health in Schools. This is an engagement award funded by UKRI, and really the goal is to set up an infrastructure for looking in detail at sleep and mental health in a school setting. This is, as I've said already, a major issue, sleep deprivation in young people. We know that it's related to all sorts of difficulties, including worse performance at school, difficulties with concentration and memory, behavioural problems, bullying, aggression. We know that sleep-deprived teenagers are more likely to drink, to take drugs, and to have driving accidents, those who are allowed to drive. And also, of course, anyone who's ever had young children will know that sleep deprivation causes anxiety and depression. That's not exclusive to teenagers, but it is a problem in teenagers, and it needs to be recognised a bit more, and the link with sleep deprivation could be recognised a bit more. So the rationale for SCRAMS, I mean, I came at SCRAMS from my interest in bipolar disorders, where of course circadian disruption and sleep problems is really central to the pathophysiology of bipolar. But increasingly, it's recognised that this circadian disruption is a feature in many other psychiatric disorders. Adolescence, of course, is a key developmental period, and yet all teenagers are sleep deprived. So just in the time when their brains could benefit most from healthy sleep, we make them get up and go early to school when they've had 6 hours sleep every night. So a good point here, I think, is that sleep represents a modifiable risk factor for mental illness, and there are lots of things that can be done, very straightforward interventions that could really help to address this. And of course, as I've mentioned with Shine, our big interest is in doing large data science work on schools-based research, and SCRAMS hopefully will facilitate that. SCRAMS, like Shine, is a big collaboration. It's been up and running for about 6 to 9 months now. It includes colleagues from chronobiology, from circadian science, from psychology, and also from charity sector. We've got Sleep Scotland involved, and we've got sleep specialists like Mike Flacker involved as well. So it's a really excellent collaboration so far. And although we haven't been able to meet in person, we've obviously met virtually quite a bit in the last few months. So things are going well. And what we aim to do is as follows. We want to build a network across the UK for schools-based sleep and mental health research. Key to this is co-production, knowledge exchange, and public engagement. This, after all, is just a 12-month engagement award. As part of that, we delivered in May 2020, not May 2019, Sleep in Schools Week. I'll give you a link to that in a moment so you can see some of that engagement work, which is excellent fun. And we're starting to do feasibility studies. So our big interest is in the relationships between sleep, cognitive function, mood, school engagement, etc. And also things like socioeconomic status, northerliness, southerliness, and seasonality of mood as well. And of course, we want to get funding for bigger projects in the future. I won't play the Blake Diary High School Sleep Week video that's on YouTube, but I would encourage you to take a look at this. It's an excellent 6 minutes of your time, just showing some of the engagement activities that the school delivered along with SCRAMS in May of this year. So I really highly recommend having a look at that. And the feasibility studies, just to give you a little bit of detail on those that we're doing. We're interested in sleep and mood, obviously, but also cognitive functioning, and also things like school engagement in young people. And the beauty of Scotland is, of course, that with schools in Shetland and schools in the borders, that's a significant difference in latitude. And we know that seasonality of mood changes in humans is really important, especially in more northerly latitudes. So there's an opportunity here to really study in a bit of detail things like light exposure, things like day length, temperature, how that interacts with time of the year in terms of producing mood symptoms and cognitive functioning as well. So that's a key focus for our SCRAMS feasibility work. We're going to use actigraphs as we did already in the feasibility study. And this time we're going to see if teenagers will wear them for a full 3 weeks, which is obviously potentially challenging, but we'll see how that goes. But we're going to combine the actigraph data collection. That will give us objective measures of sleep duration and sleep onset, and also circadian rhythmicity. So we want to combine that with twice daily ecological momentary assessment of mood and anxiety. So the participants will get a prompt on the mobile phone to fill in some scales in terms of their mood twice a day, morning and night, as part of this every day for 3 weeks. And some detail on those scales, there will be some sleep questions to back up the objective data. We'll be using a moods and feelings questionnaire, and we'll be looking at anxiety as well. So how do they feel right now? So some potentially really interesting data collected twice a day for 3 weeks in we think about 200 young people in different parts of Scotland. So Breda Cullen is involved with SCRAMS, and Breda's set up this Test My Brain platform, or rather acquired it for us from a company. But this essentially on the mobile phones, the pupils will be filling in assessments of reaction time, attention, working memory, executive function and reasoning in an accessible format. And we'll be doing that at the beginning and at the end of the 3 week period. And really, this is still feasibility. You know, we're still interested in how many teenagers will actually engage with this kind of research study. So that's a key point. We will also look at school experience. We'll repeat the adolescent sleep wake scale. We'll ask about anxiety. And then crucially, pubertal development is really important in this age group, because that's a key modulator of things like mood and anxiety and cognitive function. So it's really important to take into account. So those are the pre and post questionnaires. They're based on HBSC items. But we're also interested in understanding the acceptability of wearing actigraphs, the kids' thoughts on how the technology is useful or otherwise. And so we have some participatory design sessions planned where we will have discussions for a smaller number of pupils to really inform the design of a much larger scale study in the future. So that's really important for this feasibility work. So I've rattled through that. I think I want to finish in conclusion by revisiting the question at the start. Why do mental health research in schools? And I think my conclusion is just to highlight these 5 or 6 areas that I hope I've given you some kind of flavour of, namely that you can do research at scale that is beneficial for schools, and it's a true collaboration. It can be ambitious work, it can be population level, it can be discovery science, and there's lots more to be done, and it can be useful, it can inform health and education policy. I'm about to wrap up, but before I do, I want to say thanks to all the SHINE and SCRAMS co-investigative collaborators. Judith Brown is our coordinator, who does a lot of the organising on that. Thanks to all the SHINE schools, pupils and parents. Thanks to Generation Scotland for the Team COVID Life data, Joey and Cara who did the analysis, and SHINE is funded by the MRC Pathfinder and SCRAMS by an engagement award. Thanks very much for your attention. I'll stop there.
Very much, Daniel. That's very interesting, lovely talk. And You've given us plenty of time for some questions, and if people would like to put those in the chat section, we can start a discussion. Perhaps whilst we're waiting for people's comments, perhaps I could ask you something about the SHINE network. More interested in child and adolescent mental health is how we involve young people in planning and design research, and I wonder what your thoughts are and what you've been doing in that respect.
Yeah, so SHINE works closely with Triumph Network, which is also led by Joe Inchley in Glasgow, and Triumph is very focused on engaging younger people in population level mental health. So there's quite a lot of overlap between SHINE and Triumph, but also day to day in SHINE, we work closely with, well, many of the schools, those over 200. There's a smaller number of schools where we have a closer relationship with, and we do things with, Dunblane I showed you already, Blairgowrie I showed you. So we do have quite a lot of interaction with teachers and pupils in those schools as well. And of course they take part in conferences, and we often get them to feedback on proposals for data collection and that kind of thing. So yeah, it's quite a close, I think a reasonably close relationship with some key schools so far in SHINE to try and engage them in the co-production work.
And can I ask you if there's what are the priorities among young people, do you think, for research in mental health in Scotland?
Well, I think that's a big question, isn't it? I mean, I think there's all sorts of. Triumph Network actually have produced a report on exactly that topic. I don't know if you've seen it, but there is a Triumph report published on priorities the young people have for mental health research, and it's a key part of what Triumph does. There's all sorts of things mentioned in it. I do know, and I'm biased, I do know that sleep is an issue for many young people. Obviously, social media, is an issue. Things like not virtual bullying, but that sort of digital opportunities for experiencing bullying and that kind of thing as well. But I would have to. It'd be helpful probably if I was able to show you the Triumph report. Actually, it's published and it's online. But it's got a lot more detail on that topic.
Thanks. Here. From Eileen Hayes asking, do you know why there's gender difference in mental health issues with adolescents?
So really good question. Short answer is no, but I can take a guess. I mean, it's complicated, obviously, and we know that, in general, unfortunately, females are more likely to experience an affective disorder in their lifetime than males. That seems to be the case. Girls also go through puberty a bit earlier than boys, so that may be an issue as well. I mean, I think there's also other complex potential explanations, like girls being more likely to report emotional problems in surveys than boys are, for example. So I think it's a classic combination of maybe some biological vulnerability, but compounded by, developmental issues that are different between girls and boys, and also kind of reporting issues that are different between boys and girls as well. But it's exactly the sort of thing we want to investigate in more detail.
And Mary Stewart's asking if are the mental health differences consistent in gender? Are they consistent across the age groups?
More or less. We didn't have much of a spread, to be honest. But yes, more or less. I know that there is some data from elsewhere that these things change as you go through, childhood and early adolescence and later adolescence. But the sample that we had was relatively sort of narrow, mean age of about 14, 15. So we don't have much of a spread to be able to comment on that.
And Donald McIntyre saying, have you got any insights about social media use in girls from your SHINE study?
So we haven't looked at that in detail, Donald, but other people have. I would only be guessing, but I think the way that boys and girls use social media is obviously slightly different, and could be a big issue. That's as much as I'm confident in saying.
And do you have any data on the presence of neurodevelopmental disorders?
No, we've not collected that data. I think in the future we have talked about the fact that I think most schools know which of their pupils might have neurodevelopmental issues, at least. So there is potential to do work on that subgroup of pupils who are known to schools for having things like, I guess dyslexia, ADHD, or autism, that kind of thing. So not currently, but we'd like to do more of that in the future.
Okay. And Ellie Quinn saying, it's not necessarily your remit, Daniel, but I wondered if you know of any successful interventions or programs that have been improving quality of sleep for young people. And is it about tackling other factors such as social media, or are there other protective factors that you're aware of?
Yeah, so I actually do, strangely, know the answer to that. So Sleep Scotland is the charity that we work with, and Sleep Scotland are very focused on delivering interventions within schools to improve sleep. So they're an excellent charity in Scotland, and they've got all sorts of resources that people can access online. But one of the really interesting things that they do is they teach some of the more influential pupils in classes and in schools. They teach them about healthy sleep and that kind of thing, and that can be filtered down to the rest of the class. So they have sleep champions that they deliver interventions to. The idea being that the good sleep practice and how to deal with social media, etc., gets delivered to the pupils by other pupils, as well as from Sleep Scotland directly. So yeah, I think Sleep Scotland is certainly a good addressing that sort of issue.
Thank you. I think there's might be another question or two. Yeah, there's a few points that have been made here, and that there's some people could provide some information in the chat, which will be interesting. George McKeegan says girls are apparently affected emotionally at school age. It's sort of interesting that the subsequent suicide rate seems to be higher in young men. And you that?
Yeah, well, no, I think that's hugely complicated. So that's a very complicated issue. I guess what might not be so different is the rate of self-harm and maybe overdoses and deliberate self-harm in young women versus young men. There may be differences there as well, but I would be cautious commenting on that because it's such a complicated area.
Well, thank you very much. I think we're going to come to a close in a minute or two. I wonder if anybody has any last comments or questions that they would like to add. No, I think we've.
Okay.
Thank you.
No worries. Thank you very much.
Okay, I'm sorry about the beginning. I had two windows open, and I closed